Well, welcome everyone and Happy New Year to you. Thanks for joining the 2022 version of Crisis Jam. We've been working with our SAMHSA and NAJBID leaders on this, and we have a few new features trying to respond to what you seem to resonate with this past year. So we'll orient you to those new opportunities as we get into today's session. I'm David Covington. I'm the CEO and president at RI International and your host for the kickoff version today. So we're going to get straight into it. I borrowed the formatting here from this just terrific FAQ and infographic from the Kennedy Forum, but I used it as a foundation for Eric Rafla-Yuan, who is with us to talk about the Cárdenas 988 Implementation Act today. And in our run of show right before this meeting, Sarah Corcoran was talking about the breadth and the robustness of this comprehensive systematic legislation. So really looking forward to hearing from Eric, who we first met. We were just talking about this last spring, last early summer, when he wrote that article about equity and crisis. So we'll get into that. That's our featured presentation as we kick off the year. But we continue to grow and develop. Last year, our record participation was that NAJBID special meeting on September 15th with almost where we're approaching 400 participants. But there's about 2,100 of us who are actively participating in this learning community. And what we've done is we started out with a sort of tight registration process, and we wanted to blow that open, which we've done with this Crisis Talk landing page. The Zoom link for every week is right there available at Crisis Talk. You can share this, you could go on this at the last minute. Now, some of you have had a difficulty with your Outlook calendar item on this meeting. There is a link to an Outlook support in the reminder email that Ren Koenig sends out every Wednesday morning. But you don't need to use that. You could just know that we're going to have Crisis Jam every week except July 4th, Christmas week, and New Year's. Otherwise, Crisis Talk is on, or if Brian and John tell us to take a break, which you did do one time last year, Brian, but generally we're going to be meeting. And we've now got this new feature so that you know for sure. You'll see today, January 5th, Dr. Eric Rafla-Yuan is presenting. So that is our new way of keeping you right at the ready at talk.crisisnow.com. If you click on that Learning Community tab, you're going to go to our homepage and you can see not only the link that you can share today's presentation, and you get ready access to a landing page with the key elements from last week's, or in this case, 3 weeks ago when we last met. Now, today, our first feature, we've tried to be much more interactive and engaging. And so we're going to do a word cloud. We're going to have a different question every week. But today's question is, what's your top crisis priority for 2022? What's your top crisis priority for 2022? The easiest thing to do is don't do the online, go to the text, because that way you can just pick up your smartphone. You're not distracted on this Crisis Jam computer screen. Just go to your phone. Bring up a new text. Lisa, you did this just a few minutes ago. Type in 22333 as the number you're addressing, and then for the message, write Crisis Now. And what you'll get when you do that is it will enter you into an active chat, and you can put in a word or a phrase. You can put more than one if you like, but certainly put in one, and we'll come back to this later in the Crisis Jam. Karen, if we can put into the text chat a couple of times so people know this, but it's text Crisis Now to 22333. And then once you're connected, then put in your top crisis priority for 2022. If you put a paragraph, it's going to squeeze all down, right? So a word is best, a short phrase is okay. And we'll look forward to getting to that at the end of the show. The other thing that we have in the Crisis Jam is we're going to start doing a more formal latest crisis news, especially as this starts to pick up. I've heard some of the Vibrant staff talking about this research that came out about the Logic song and the uptick in crisis calls to the lifeline that occurred and the reduction in suicide deaths that was seen at the very same time. We were talking with Matthew Goldman earlier. We've got a data and evaluation corner coming to the Crisis Jam in coming weeks. We'll lean into these types of things, but for now, we're just going to highlight this, and one of our team's going to drop the URL into the text chat if you'd like to see that more. The other article that came out, and we're starting to see a few of these types of articles. Many states aren't ready for a 988 crisis line. The deadline is looming. And look, we are in the first meeting of January. This is January of 2022. We're now 6 months and a few days away from the formal launch. Seems like a long time ago when Dr. Richard McKeon first kicked off a very small group of us back during this, the summer of COVID in 2020, meeting together. And now we're within 6 months of this formal launch. But the sort of tension that comes to me, I had an opportunity to hear Dr. John Franklin Sierra speak again here just a few weeks ago, and he used this T.S. Eliot quote, between the idea and the reality falls the shadow. John, are you on the call by chance?
I am.
So John, you made a statement about it was the baby steps. It's humbling the amount of work we have to do, but do you remember that exact phrase you used, John? I thought that was fabulous. Yeah, we got a lot. It can be overwhelming, but how did you say it, John?
I said it's a sink full of dirty dishes, and like, you know, it can feel overwhelming to look at it all in the aggregate, but it's about identifying the baby steps, working through them iteratively, just one piece at a time, just like any big complex problem.
Love it. And John Franklin Sierra will be our first 3-time Crisis Jam featured presentation here in a few weeks. He's going to give us a systems engineering 101. But, you know, for the folks that were involved in developing the emergency medical response system in the 70s and 80s, for them, I bet they would see 2022 as 1967. That was the year the first 911 call was answered. That was when they began to say it's safer if you're injured on the battlefront than if you're on the streets of the US and you have a car accident or a heart attack. And they began to push forward ambulance care and easy to access emergency departments. And yet it took years. It's not going to take us 20 or 30 years. We are making huge gains, and yet staying focused with those baby steps. But let's also think boldly. So Eric, tell us about this legislation that Tony Cárdenas is bringing forward, and your role in supporting that. We're all excited for our first featured presentation of the new year.
Thanks, David, and excited to be able to talk to you all. Really looking forward to what comes the next 6 months. Something that I've had to catch myself doing is saying next July, and now it's this July. So that's a lot of work to be done. And so I'll just talk really briefly about my background. And so I'm a psychiatrist. I was at UCSD for the last 5 years before coming to the Hill last year. And now I work in the great honor of working in the office of US Congressman Tony Cárdenas. And so he is a California congressman, and mental health is one of his priorities. Another one of his priorities for a long time has been ways to get armed law enforcement officers out of issues where other specialists would be better suited. And so 988 and the timing really aligned with my time here in DC. And so really excited to be able to be working on this bill. Next slide, please. Almost always I have to do some discussion about what 988 is and why it's important. Hopefully we can just skip through most of this part pretty quickly. But one of the things I'll highlight is that there needs to, when I talk to folks on the ground, so local agencies, the county or state level, there's a lot of sense of urgency. In talking to members and staff on the Hill, there's a sense that 988 was something that was passed last year and that it is something that was already finished. And so a lot of education is what I'm having to do about why it's important that there's federal support for this 988 implementation. Next slide, please. So really excited to be able to talk about this piece of legislation. So it builds off another bill, which I'll talk about briefly, which was the Behavioral Health Crisis Expansion Act. So that one was led on a bipartisan basis in both the House and Senate. But it talking again with a lot of stakeholders, it sounded like that bill sort of had a couple more pieces to do in terms of, we had a couple more pieces that we need to do in terms of implementation to even get to a point where we could start doing reimbursement for crisis services. And so really the point of this larger bill is to include that bill as well as a number of statutory items for changes to language to make crisis services possible, as well as one-time infrastructure investments to help support states in setting up their 988 services. And so clearly this bill is being led by my boss, Representative Tony Cárdenas, also Lisa Blunt-Rochester and Representative Fitzpatrick, and we're excited that the bipartisan chairs of the Congressional Mental Health Caucus, John Katko and Janet Napolitano, are joining us on this. The other thing I'll say is that we envision, as Sue were all saying, that this will be a development. And so pairing the introduction of this with the bipartisan Congressional Crisis Services Task Force in conjunction with the Mental Health Caucus to help push these developments forward. There are a number of things which we thought were important but didn't quite make it into this bill in terms because of timing and just how large it was getting. One of them, for example, is accessibility, and so texting and language support for 988. And so there are a lot of future things to be done as well that we hope to see successful through the task force. The principles for this bill really aligned with some of the information and put out by SAMHSA. We wanted there to be someone to call, someone to come, and somewhere to go. And so the bill is really designed to put that in, to implement those. And so it was designed as a comprehensive policy outline. We don't necessarily anticipate that the whole thing will pass at once, as it is fairly large. One of its purposes is really to do a comprehensive outline of what it would take to make the SAMHSA 2020 guidelines successful or implementable at the state level. IMD has been an issue that has come up time and time again, and we wanted to sort of proactively make sure that IMD exclusions didn't interfere with 988 implementation. And sort of by definition, crisis services are short-term and really shouldn't run into IMD issues, but there's been a lot of issues we've been hearing from state stakeholders where no one wants to build any sort of mental health facility if there's a concern that at some point they're not going to be able to receive reimbursements for that. Another thing that has been missing in crisis services is research and evidence collection, and so we wanted to make sure that that was included, because if you're a state or a county strapped for cash and trying to develop some services, the last thing you're going to be able to do is set up a research infrastructure. Workforce development is another important thing. And then another constant tension that we've been working with and hope to have some success with is the tension between being too prescriptive, having standards, and being too prescriptive, knowing that every state is different, has different needs, both geographically in terms of population and culture, as well as the resources that they have. And that we didn't want this also to push out or cause difficulty for states or communities that already had crisis services going that they thought were successful. So we wanted to support what was already being done, but also have some standardization so that we can move towards more evidence-based services. Next slide, please. And so this great graphic from Dr. Balfour, Dr. Golden, and colleagues really highlight some of the crisis continuum of care that we're hoping to develop with this bill. And I imagine many of you are familiar with this or another version of this. So talking now about the bill that this builds on. So the Behavioral Health Crisis Services Expansion Act was a really great piece of legislation led on a bipartisan basis. In the Senate by Senators Cortez Masto from Nevada and Cornyn from Texas, and then on the House in a bipartisan basis by some of the similar leads as our larger bill. And so this does a number of important things. One is it sets national standards. Two, and this is actually a very expensive piece, is it expands coverage. And so Right now, crisis services often are covered entirely by the state or by a county, sometimes even police departments, depending how things are structured. And so this bill requires that crisis services are covered by all public and private health insurers. And we see that this is a really important piece needed to ensure the longevity of crisis services. Because what we're seeing right now is that a lot of mobile crisis teams operate on time-limited grant programs, or there has been sort of one-time funding, but states are really hesitant to build infrastructure without a consistent source of reimbursement. And so by attaching health system dollars to health system services, we think that's a really important piece in moving crisis services forward. And having them be like a permanent portion of life in the United States. Next slide, please. And so this now gets into the pieces of our actual bill. And so I saw recently that SAMHSA is already on their own trying to develop a 988 coordinating office. So that's great to see. Our bill authorizes funds for that specifically, and also tasks that office with the research and development and technical assistance for the states, things like this. Because right now, SAMHSA has a fairly limited team, which what they're doing, trying to do a lot of work, and we want to make sure that they have the resources needed to make this a successful endeavor. We increased the authorization ceiling for the Lifeline itself, and also add special appropriations for specific services needs. We expect perhaps there'll be some technical changes to this language, but we know that there are special populations, whether it's children, adolescents, on tribal reservations, et cetera, where they may need special considerations for how services are done through the Lifeline. And so we want to make sure sometimes we're available for that. We authorize money for technology training and operations for the Lifeline itself. And this has been really important because 911 is very standardized and has technology and training for that. But the Lifeline is on a not parallel. It's very different. And for 988 to be a real and robust alternative to 911, we have to make sure we invest in technology. So that's what that's for. And the last item here is we permanently authorize the mental health block grant set aside for crisis services. Congress has done a fairly good job in the past 2 years of including that, but in order for crisis services to be a permanent fixture, that has to stay. And so that is what that is about. Next slide, please. So as you can see, SAMHSA is up in front and center in this bill, and I think they're doing a great job so far. This last piece for SAMHSA authorizes funds for mobile crisis pilot programs. And this we wanted to make fairly broad and what could be included as specialists in mobile crisis teams, knowing that different communities have proposed different solutions that they think will work best for them. And so we wanted those, right now as crisis services are very new, we wanted to have flexibility in that. And so the range of entities that can apply to put forward grants for these pilot programs is fairly broad. And so all the way down from state to county, even to a single nonprofit, as long as they can demonstrate that they have a history of working in the community they propose to serve. And so this is for HRSA, the Health Resources Services Administration. So capital development grants, the actual crisis centers themselves are few and far between. And we wanted to make sure that states could implement these because that, as you saw in the graphic, those little houses, that's an important piece of the crisis services of care. Otherwise, if you have mobile crisis teams, nowhere to take them, they'll just go to the emergency room. And then also to below that to expand HRSA's definition of crisis services workforce, that not just mobile crisis, but also those in call centers and crisis receiving programs to be eligible for HRSA grants. So more to be done on workforce, but that's a start. And so the state crisis care option. So this one thing in terms of where states are in crisis, there's also very different political realities of what states are interested in. And so our bill doesn't mandate that states do these services. However, the state crisis care option increases the FMAP. So that's the matching percentage that the federal government pays for crisis services. So this will serve as a really nice incentive for states that are thinking about developing crisis services or have some going, is that the federal government will match 85% of those crisis services. Next is the Imd Amendment. And so that, again, just to legislatively preempt any IMD issues. For example, if a crisis center, crisis receiving facility has 10 beds for kids and another section has 10 beds for adults, and all of a sudden now they have 20 beds, we want to make sure that that doesn't become an issue. And so that's what that is. And the last portion is to expand the CCBHC partnership for any state to be able to opt in. And we've heard from a lot of stakeholders that CCBHCs have been a really fantastic provision or I guess service provider for crisis services, and they've done a really impressive job, and we wanted to make sure that that option was available for every state. Next slide, please. Okay, so that is all of the slides. We have a number of infographics and also the legislative text, and so I'll drop my email in the chat if folks want to reach out and learn some more details on that. In terms of timeline, we're looking at an introduction at the end of January, and so appreciate any support or endorsements anyone feels that they may be able to provide, as well as if folks have input on next steps for what the task force should be working on, or possibly even for this bill. For this bill, with the January introduction, we're coming up to an end of what things we can change, but always interested in hearing feedback or what would make it more effective. So with that, happy to take questions, and also I think shifting over to our roundtable.
Eric, thank you so much. This is reminiscent for me at the state level of what Colorado did in 2013. We had never seen anything as systematic, as integrated, and as at scale as what Colorado was envisioning at that time under an initiative of Governor Hickenlooper. And it feels the same way. But let's get some comments and reflections. Let's start with the Senior Vice President of State and Federal Advocacy at Mental Health America. Welcome, Debbie. Your reflections.
Thank you, David. And Eric, thank you so much. And a special thank you to Congressman Cárdenas and his co-sponsors for their important work here and putting what will be an outstanding piece of legislation forward. It's really going to be groundbreaking in many ways. And I have 3 words that I would like to say to reflect on this bill, and that's deflection, community, and comprehensive. With respect to deflection, for many years now, within the behavioral health advocacy community, we've all worked together as a top priority to divert people out of the criminal justice system. Much progress has been made. But what this bill will help do is move us towards deflecting folks away in the first place from the criminal justice system. And what an important thing that will be to get people who are experiencing some kind of mental health emergency, a healthcare response. And that leads me to the second piece, community, in the community. The act is looking at states having different needs, as you pointed out. They're going to be able to develop what's needed in their communities, and all the services will be provided in the community. And what an important piece that will be. Of course, developing workforce, and really important pieces of the workforce are spoken about in this bill. Peers, what an important addition to the behavioral health workforce and to recovery. Peers, people making that immediate connection And boy, does someone experiencing an emergency need to make that immediate connection. Well, there aren't peers everywhere. Yes, we've been relying on police, but there's another piece where really it's everywhere in the country, and that's EMS, emergency medical response teams. And this bill also puts in the ability to work with those groups where they are, even in hard to reach places, in rural places, like where I am in the middle of the Rocky Mountains, way up high. So that's a really important piece as well. But the responses themselves are going to be local, all around that call center, putting more money in for the lifeline, getting to that someone to talk to who's really in your area, that mobile piece that's really in your area, if it has to be EMS or peers or mobile teams, but some people who are local and local centers, if you need that somewhere to go, not the overwhelming emergency department, not in jail, in the criminal justice system. And lastly, it's comprehensive in terms of access. This is really, again, groundbreaking, that people will be able to access emergency services in this way to respond to their emergency, to their crisis, no matter what kind of insurance they have. So we don't have to worry about if it's just Medicaid. It will be paid for by Medicaid, Medicare, private insurance, ACA, ERISA plans. Those are the important employer-sponsored plans, through the TRICARE for veterans. So we no longer have to say, well, it depends on what kind of insurance you have. So that, again, is very, very groundbreaking, comprehensive. So those three words, again, are my reflections: deflection, community, and comprehensive in terms of access. Thank you so much for the opportunity to speak to this remarkable bill.
Wow, Debbie, that's just terrific. And the deflection, you referenced law enforcement. We've got Ron Bruno, Executive Director at CIT International. Ron, your reflections on Cárdenas legislation.
Absolutely. Thanks, David. And I'm just going to echo what Debbie said about the appreciation for this act. I mean, this is really groundbreaking because we're bringing things together. I'm also going to continue to build on the one word. It seems like that's what we're doing here today, those special words. Mine is intrusive. Because realistically, when I talk about a crisis response system, I always talk about that it really needs to be the least intrusive into a person's life. If you look at the intrusion of a crisis response system, the most intrusive is going to be sending law enforcement out to basically cuff somebody up and take them to a local emergency room. So that's the most. The least, handle it telephonically. And that's what this bill is starting to address, is what is in between those two. Because if you think about it, we've always had law enforcement being able to go out and respond. And we've always had, or for the longest time, we've had the National Suicide Lifeline. So people could reach out and get things handled telephonically, but it never took off in lines of people thinking about reaching there before they reached out to 911. The important thing about this bill is all of that in between, is the person to respond. And we need to really look at that in the lines of, again, keeping it the least intrusive so we can send non-law enforcement mental health services out to deal with the greatest majority of crisis situations. But law enforcement will always have a role in a crisis response system. So we need to make sure that every single community has a cadre of specially trained law enforcement officers in patrol so that they can quickly respond when needed to those situations that warrant it due to some level of danger or some type of a criminal concern. And we need to train those law enforcement services how to work in partnership with the non-law enforcement crisis responders so that way we do achieve the safety issues when necessary, but we are always addressing the mental health needs with the mental health services. And then, of course, where to go. That is so important, is because going and utilizing ERs are not necessarily the best way to assist somebody who is in a mental health crisis. So we need to come up with some method, whether that be a dedicated freestanding receiving center or an access center, which is part of a hospital system, but completely and separate from the emergency room. And so I'm very excited to see this legislation push through and to be able to start to support monetarily these different types of components of a crisis response system that we have so badly needed for so long. So I too am so thankful to be able to speak on this and support this act any way that we possibly can. Thank you.
Terrific, Ron. And we had Major Cochran, one of the founders of CIT, on last year, and that vision, Ron, you're talking about is a long-standing one with CIT, and so exciting to see that moving forward. And that least intrusive, how often does that also happen to pair with more caring, more effective, and less costly? So great stuff, Ron, Debbie, thank you so much. And Eric, you can please take back to Representative Cárdenas. You heard groundbreaking several times from the leaders here, and we'll hope to have a comment from John and Brian when we get to their relative updates as well. Today's crisis talk, we actually normally, Stephanie is interviewing an industry leader, a person with lived experience, et cetera. But we also occasionally have someone outreach us and say they'd like to write something for Crisis Talk. Lisa Job Shields is the Deputy Director at Community Services, the Division of Community Behavioral Health with the Virginia Department of Behavioral Health and Developmental Services. And Lisa, you came to Stephanie and myself and pitched an article which we're publishing today. I'm really excited. So tease that up a little bit, if you would, and encourage people to go to Crisis Talk and read what you and Dr. Catherine Hawks wrote.
Thank you so much. Yeah, so as someone who has been joining these calls, but really from the, I don't operate any crisis services directly. We don't even administer any directly, but more in the, policy, general behavioral health sphere, wanted to really kind of dig into some of the questions and issues that we face for, I'll say, my fellow bureaucrats on the call as it's come to implementing 988. So, really wanted to dig into this systems approach. And, one way people will often talk about systems thinking or systems doing is you're essentially trying to notice what's invisible, trying to understand the rules that make the system behave in certain ways. And so for 988, a couple of the things that really essentially we're just kind of raising, we don't really give you any answers, we're really just raising more questions, come to do with accountability. For example, in the healthcare sphere, a lot of states have moved to more of a population-based accountability versus geographical, right, under managed care arrangements, whereas law enforcement and public safety entering points are geographic accountability. Now in Virginia, we actually do still retain behavioral health geographic accountability, but again, it's these types of issues where I think there's a lot to really kind of dig down into and understand. So one small example related to that would be how the Imd exclusion was mentioned earlier. So similarly, often when folks are incarcerated, every state has different policies and protocols regarding managed care responsibilities at that point. And so with that being such a key feature here, that's something that we really don't want to lose, for example, when we're looking at data collection and when we're holding whoever our contractors might be accountable, really looking at not just hospitalizations, but also incarcerations. And again, making sure that we're actually able to create those, denominators. And so essentially the one thing I'll kind of highlight specifically is that a lot of this work has already been done when it comes to essentially governing complex systems and how do you do that in a psychologically informed way. There's a whole group of folks doing that work. They've pulled some of it together. This is their book. And for those of us in behavioral health, you'll see that the behavioral health, it's Dr. Stephen Hayes is actually on the behavioral health side, sort of these evolutionary folks and psychology. They've really come together and really kind of put into words what does it mean to take a polycentric approach to governance. How do you get people with overlapping authority to cooperate and plan in this way? And what are some ways that we can do that better? And so I'll point to that as a resource for any of us that identify as stewards and really want to get this right when it comes to some of the more systematic features. Thanks.
Great, Lisa. Stewardship, innovation. And look, Virginia, the integration with the Virginia Medicaid and the work that you guys have done in thinking through the next steps, the legislation you've passed, we are working with you on the state card for Virginia. We'll hope for you to present here in coming weeks. So thanks so much. I hope you'll read Lisa's article. So let's go to, and please, any of you, please outreach us. Stephanie and I are happy to work with you on an article like this and look forward to having more of your voices. Well, let's go to SAMHSA and John Palmieri for an update.
Thanks, David, and Happy New Year to everyone. Good to see you all. So I'm actually really inspired by the conversation thus far in this meeting in terms of the broad view of crisis transformation and integration of services. And really, I think SAMHSA has for a long time now really seen 988 really as kind of this opportunity, this catalyst, cornerstone for the broader transformation, and really recognizing that unless we can really fully leverage all the opportunities to make inroads in the full continuum of crisis services, I think that's really the only way that we're going to have really the impact that we're seeking with respect to serving individuals and communities. So very, very excited about that conversation and really looking forward to continuing to advance the conversation as we look at 988 operational readiness and sort of broader crisis transformation. So in that line, David, I'm not sure what's on the next slide, but if you could advance that. Yeah, so in that line, obviously, I think most of you probably are aware of this, but there has been recent notification regarding state eligibility for qualifying mobile crisis intervention services to receive an 85% FMAP, which is a really exciting, I think, opportunity, again, to start to look at some of those coordination and integration opportunities that are really necessary to really make the most of the crisis response. So just wanted to flag that, and there's more detail. I don't know if we could maybe put a link for those of you who don't have it, but definitely more detail to take a look at there.
Karen will drop that link in the chat, John.
Okay. Related to that, SAMHSA is holding a convening next week, which is really focused in on for state leaders, providing guidance and to highlight examples of how states can better use Medicaid funding to build robust crisis systems. And so that's really across the crisis continuum. This is a virtual event that actually mirrors a program that I think we mentioned a few months ago that was held in the late summer for regions 2 and 3. And this is now open essentially nationally to an audience of state leaders, again, really around sort of specific sort of guidance tools, best practices with respect to crisis financing. And that convening will be used in part to develop some additional data and information that's going to be used for a further convening or a separate convening in the February-March timeframe, which I will talk about in much more detail next week during our more in-depth SAMHSA presentation. But that really is a convening that's really focused broadly on readiness for 988 and crisis services implementation across a broad audience set. And this meeting next week on the financing, I think, will be a useful opportunity to sort of learn from states in terms of where they are, what their needs are, and will definitely inform the readiness as we're kind of developing our understanding of that and using that readiness assessment to inform specific operational tools and supports that we can provide to states and other audiences. So there'll be more on that next week, but I just kind of wanted to highlight that for a moment. Also, as this slide currently indicates, we are on the 988 team looking for a director. That position has been posted on USA Jobs. I currently have been sitting in the acting role, but the intent was always for me to be in an acting role until there was a permanent lead. So just wanted to flag that opportunity. I know there's tons of expertise in the field, and so I think that there are lots of individuals who could bring a lot of value to that position and to the team and to the activities within SAMHSA. This is a current snapshot of the team that continues to grow. We do now have a new digital communications lead. I don't know if Stacy, if you're on the call by any chance. That's okay. We're actually going to, I know that there's been in the chat, there's been some comment about the importance of messaging. And I know, David, you and I had talked about having our communications lead actually facilitate a separate presentation to this group on communications and messaging, which I think would be really important as we're moving into 2022. So I think we're scheduling that at some point later this spring or winter, correct?
Yes.
Okay. Next slide, please. This is just a review of our pillars of activity, which I'm not going to go through in any detail right now. But again, we'll spend more time talking about it next week during our deeper dive into the operational readiness piece. Next slide. And then this, I wanted to highlight before turning it over to any other SAMHSA colleagues, which really announces some key accomplishments that we've been able to implement over the past days, weeks, and months. So finally, after much discussion and fanfare, we have formally released the 3 reports that we were required to. The appropriations report, which we had mentioned earlier, is published on the website. And then our 2 reports to Congress on training and access and on resources have also been released to the Hill. So we're really pleased that we've been able to do that. And I think within those reports have been able to signal some of that broader vision around crisis transformation that I referenced earlier. And then also just wanted to remind folks of our recent, really unprecedented investment in the transition to 988, which does include funds to support the existing Lifeline Network Administrator, along with sort of infrastructure backup, chat and text services, and then also an opportunity for states to enhance their capacity at the state, regional, and local level. And that state NOFO was released and is currently open for applications until January 31st. I think that's it for me. And then I don't know, Richard, James, anybody else on the call, you want to add anything?
Yeah, hi everyone, it's James. I would just say that with that state NOFO, if you are or are not, please try to reach out and work with your state to identify their readiness for response by that. Again, it is the end of the month, so we know it's a short period going across a holiday. We are also hiring a team of GPOs that has closed and will be the overseers of that under the 988 office and under me as chief of the crisis center operations. So we are excited to get those states on board in this collaborative effort for 988. Just a reminder that a majority of at least this funding is going to be going to states and ultimately impacting the Lifeline crisis centers who are responding on behalf of the state or territory. So we're excited for the first time that that'll actually result in service funding for the calls being answered at the state and local level. So very excited for that. Anyone? That's all I have. Anyone else?
Yeah, this is Richard McKeon. So I'll just echo James that we certainly hope that every single state and the eligible territories will apply for these funds. I think this is a major milestone in terms of policy program and funding. So we are very much hopeful that there will be a strong response from states. We also anticipate that there will be RFPs coming out from the Lifeline to support some of the centralized services currently, the chat and text centers, Spanish language centers, and the backup centers, which are the other really important piece to this. And then finally, the other thing I would just mention is that we the amount of work going into 988 and 911 collaboration is increasing significantly. I think probably would be great, maybe in a couple of months to present some of that on this crisis jam. And, much of that is being driven by SAMHSA through various different ways. But I'll also mention and we're very grateful that the National Emergency Number Association has initiated a work group and is on 988, 911 collaboration, which I'm glad to be able to participate in. And I think that will be really important as well, because there's a lot of work that needs to be done in that area, and including communication for those of us, who are really engaged around 988, the people who spend their lives involved with 911, emergency medical services, the public service answering points, etc. So we'll look forward to letting you know more about that work in the weeks and months ahead.
Great. Thank you, John and Richard and James. Let's go to Brian Hepburn with the states.
Thank you, David. And this has been another very impressive hour. It's amazing the energy and work that's going on out there. I wanted to specifically thank Dr. Rafla-Yuan for the work that he's doing with Congressman Cárdenas, that this is really important. For a long time, it seemed like there was a lot of energy in the field, but we weren't getting much traction. And the fact that we're seeing this bipartisan legislation, it's so comprehensive and so supportive to the work that's been done in the field for all these years. It's really energizing. So thank you. Also wanted to thank SAMHSA. John Palmieri mentioned that he was he's been fantastic in that acting role, and has really helped provide that needed leadership at SAMHSA for 988 and crisis services. Also want to thank James for his efforts, and specifically give a shout out to Richard McKeon. Richard has been involved in suicide prevention for a long time. And he was one of the first people to start this jam. He started, I guess it was about 16 to 18 months ago. Yeah. And I remember early on, sometimes it just felt like there were 3 or 4 of us in the room. And Richard was the leader. He really pushed it forward. He's been a voice that's been there for throughout his career, pushing for suicide prevention and for crisis services. So I want to really thank Richard. I want to thank you, David, because of it was good. We all had a break for a couple of weeks, and now you're coming back with this energy. It's just very impressive. And I want to thank you for the effort that you've done nationally and moving ahead with 988 and crisis services. So now I want to mention a little bit about what's happening in the states. As you all know, COVID has not left us. And at this time, this first week in January, the big focus of the states is kids going back to school. Are they going back virtually? Are they going back in person? How is that impacting parents? How is that impacting teachers? How is that impacting health departments? We seemed to get a little bit of a vacation because we were on holiday for a few weeks, but now it's right back in front of us. And leadership and behavioral health all around the country are addressing these issues. We know that this is a very difficult time for kids and families, and we're trying to be as supportive as possible. So the main focus all around the country in terms of behavioral health leadership is in how do we help kids, how do we help families, how do we move forward to confront this infectious disease, but also how do we deal with the stress and the impact on mental health and on substance use disorder. That's the main focus right now in the facilities. So with that, let me turn it back to you, David, and anybody who's got good ideas about how we can help kids, please let us know.
Terrific, Brian. Thank you so much. And Brian, any reflection on your theme for your 2022 series, or that's in discussion with SAMHSA and we'll be hearing more?
Yeah, we have decided on the papers for 2022. It'll be a continuation of our Beyond Beds theme. We really want to hit hard the importance of trying to take care of individuals in the community, providing as much support as possible. decreasing the need for law enforcement, and trying to get to individuals early before crisis, and also trying to have an impact after crisis to help people recover so they don't go back into crisis. But I also wanted to highlight a paper that was mentioned earlier, and that was the paper by Dr. Margie Balfour. It was one of our 2020 papers. So if you go to Crisis Now and you click on that, the icon for 2020, you can go to the paper on law enforcement and crisis services by Margie, and that's a paper that was referenced earlier. I think the whole series is of interest, but related to today's presentation, it was Margie's paper. So thank you, David, and thank you for your hard work.
Oh, thank you so much, Brian. And Brian, you've been talking COVID exit strategy, and of course, Omicron, we're at levels we've not seen before, but our medical leadership here was talking about Dr. Fauci's comments yesterday of signaling a shift from infection to hospitalization. So it just feels like we're so close to making a difference, and look forward to more discussion about that, especially as it pertains to youth. So today's Crisis Trivia Hot Seat, we have adopted a straight up Who Wants to Be a Millionaire style approach. And Chuck Ingolia with the National Council for Mental Wellbeing, thanks so much for you volunteered, right, Chuck? You called me up and said, hey, can I be the first out of the gate for 20? Did I understand that correctly, Chuck?
That would be negative, David, but I'm willing to help here.
So Chuck, you've been doing policy and legislative engagement for how many years?
Many.
So I thought of you for this question. I was crisis when crisis wasn't cool. Richard and I was trying to think of all the people who are on the in the panel that was put together in 2017 by the National Action Alliance as they arranged a congressional crisis briefing. Now we have changed the format. Now, Chuck, you get the audience's feedback, whether you want it or not. It's coming to you right now. So Karen, if you will bring up the poll, we're going to ask everybody in the audience to give their response to this. So let's see if Karen can, there it is. So just click, I'm going to take mine off the screen as I answer it myself. Everybody click an answer and hit submit, and we're going to give it about 10 seconds. 9, 8, 7, 6, 5, 4, 3, 2, 1. Let's give Chuck what the audience thinks the answer to this is, Karen. We're going to bring that up. So the audience doesn't know, Chuck. The audience is no help, but you can phone a friend as long as it's not me or Richard, because I don't remember right offhand. No, John was in it. So me, John, and Richard are the only people you can't phone, Chuck, if you'd like to phone a friend.
In the interest of time, I think I'll skip that option. But I mean, I can't remember yesterday. You want me to remember 2017?
Yes. So Chuck, look at the answers. I was trying to set you up a bit by looking at, these are all amazing pairings around crisis legislation.
Yeah, I'm going to have to go with D, David.
D, Chuck, I love it when, you start out the year with the right answer. The Crisis Now briefing that Napolitano and Katko kicked off in 2017, Colleen Carr and the National Action Alliance put that together. It was a small group of us, but looking back, I really do think it was key to accelerating the momentum and laying the groundwork for now 988. And Richard, I'll be interested in your thoughts on that, but let's first go to a special introduction from Sarah.
Yeah, thank you, David. And we have a special guest today in light of this question. We've got Joseph Chacon from Congresswoman Napolitano's office. She represents the 32nd District of California and is one of the co-chairs, along with Congressman Katko of the House Mental Health Caucus. So Joseph, you have a few comments for us on this. Thanks for being here.
Yeah, thank you, Sarah. And thank you, David, for putting this together. It's honestly really great to see, mental health organizations, SAMHSA, working together to really kind of work on some of these issues that, are affecting, our constituents around the country. As Sarah said, my name is Joseph Ciccone, and I work for Congresswoman Grace Napolitano. She is the co-chair of the Mental Health Caucus with Representative John Katko of New York. And really the main goal of our caucus is, how can we educate members and staff about some of these issues? So one of the easiest way for us to get that information out is just like this briefing that we hosted in 2017. and it allows, staff to hear directly, from organizations, from people with lived experiences, from, local, state, federal government about what's really happening kind of in the space of mental health. We also do a few other, meetings throughout the year. We send around an email to our staff and update them on news clips, any letters or bills that have been introduced. But we really want to try to work, with other offices so everyone's kind of on the same page and understand, what's going on. I also want to thank Eric for that great presentation. I think one key point that Eric really brought up is that, last Congress, we passed the bill for 988. And I think it's really important that we educate staff as to what that means and what other options, need to be taken. Just speaking for our office, but, we use this as a resource. We put in our press releases, we tweet about it, we post it on Facebook. If we're directing, our constituents to it, we want to make sure that those resources are there and they're available to them. So far, really impressed that, this meeting is taking place and everyone's kind of sharing, the information as to what they're hearing. So thank you again.
Oh, Joseph, thank you so much. And Sarah, thanks for making that. Please pass along our appreciation to Napolitano. This is just terrific work that she and Katko and everyone is doing together. So let's go to Sarah. It's back to you. And a quick update on where we stand, Sarah.
Yeah, absolutely. And if we could go to the next slide, I'll try to go through as quickly as I can. At this point, Build Back Better, the reconciliation bill, was passed out of the House, but has not moved in the Senate. We're expecting this to be a Q1 2022 activity at this point, given some moderate pushback on the Democratic side in the Senate. If the bill does not move forward as it is now, I think we will find out more towards the end of this month into the beginning of next month. But that February 18th deadline for the continuing resolution, which is keeping the government open and funded, is a bit of a forcing event to really see if things can kind of move side by side or together at that point. But even if the bill as it currently is does not pass, there are a few other opportunities to move, especially the mental health, behavioral health components of that bill, which include Medicaid reentry, CCBHC's /Excellence Act, as well as a few other components, including the permanent extension of the CAHOOTS FMAP bump for mobile crisis. So we'll have a few more opportunities, hopefully, to move that forward if this does not continue as it is in Build Back Better. But as of now, we're not sure. There will be that Senate finance package focused on mental health that we're expecting at some point this year, as well as consideration of a prescription drug user fee act. And then one more thing that I'll flag. The Senate Finance Committee has announced a hearing specifically on kids' mental health and the crisis around kids' mental health. That will be on January 26th. I'll drop a link in the chat for the press release. We're expecting the Surgeon General as per the announcement and given his press release last month, but as of now, the rest of the panel or panels has not been announced, but we'll keep a close eye on that as that hearing comes together for later in this month.
Great. Thank you so much, Sarah. And Joanna Rosen with AFSP, just given the time today, we're going to prioritize getting you into the jam this coming week. Joanna, can you just say hi to everyone in your new role?
Hi, everyone. My name is Joanna. I'm from American Foundation for Suicide Prevention. I just started as a manager of federal policy. I don't have anything to add to Sarah's update, but it's great to be here. I am stepping into Connor's shoes, and Natalie has also departed, so I am going it alone on the federal team for now. I'm not sure if Laurel is here, but she's also supporting the federal side of anything. So feel free to reach out to us if you need anything. I'll drop my email in the chat just so that everyone has that.
Welcome, Joanna. Welcome to the learning community, and thanks for AFSP's ongoing leadership here. We're right at time, so I'm going to try to, Laura Evans and the team, Hannah and Steph at NAMI, let's do a state by state this coming week. But do note, we do have a link to the great NAMI crisis dashboard on this slide. Karen, if you can drop that into the chat, and we'll go into more detail. They've changed the formatting and I really love it. So we'll go into that next week. Kim, can you say 2 words on the new slide, and we'll do more detail on this next week as well?
Sure. So this is just kind of the capturing of all of the core points of the legislation that has passed in Utah. It passed almost a year ago. We're going into our next legislative session to kind of build on this and are looking forward to figuring out what's next. I will drop a link in the chat that has the report that was required as part of this legislation, but we don't have a fee, but we do have some significant allocations. And we'll continue to share as we learn.
All right, so let's end with the word cloud for today. John, and we'll start with you. Any reflections? It looks like funding and equity are the top two comments here, but there's a lot of different phrases that came through.
Yeah, funding. I mean, staffing. I know that the workforce is a huge concern, so that really resonates for me as well.
Brian?
Yeah, similar to John, I think equity is a big issue there, and achieving equity through making changes in how we do crisis services, I think is the biggie. So
great,
good to see that.
For those of you who we didn't get through to today, I apologize. We'll prioritize you next week. We've got some new episodes on Moving America's Soul on suicide, and finally. You can see the full roadmap at the Crisis Talk website. So I won't go through it other than to say we're having the first of two operational readiness presentations starting next week with Dr. Palmieri and the SAMHSA team. Richard, we talked about you a couple of times in this call. You want to roll us out with any reflections for the new year?
Well, I will just mention that that 2017 meeting that you referenced, the congressional briefing, really, I think, sowed seeds that, along with other, sources, have really come to fruition with this unprecedented focus on crisis services. And I think, this is the year where I think we will see a lot of things come to fruition, and that hopefully we will look back on 2022 as a major transformative year in which our nation took important steps forward in how we provide suicide prevention and behavioral health crisis care. Also, I will leave it there.
Thank you so much. And thanks for joining us in this first Crisis Jam. We'll see you next week. Take care.